Hello everyone, you're tuned into Brainetainment, where we explore complex health and science topics in a fun and accessible way. Our mission is to break down the jargon and make the world of health and science easily digestible, one topic at a time. Today we're turning our spotlight onto a common but often misunderstood sleep disorder that affects countless individuals worldwide. In today's episode, we're diving deep into the world of sleep disorders, specifically sleep apnea. Have you ever heard of sleep apnea? It's more common than you might think, and it can have serious health implications. Sleep apnea is a sleep disorder that involves the cessation or significant decrease in airflow in the presence of breathing effort. It's as if your body forgets to breathe while you're sleeping, or something physically obstructs your airway. This can occur a few times a night or several hundreds of times per night, and you might not even be aware of it. There are three types of sleep apnea: obstructive, central, and complex. Obstructive sleep apnea, the most common form, is caused by a blockage of the airway, usually when the soft tissue in the back of the throat collapses during sleep. Central sleep apnea, on the other hand, occurs when your brain doesn't send proper signals to the muscles that control your breathing. And then there's complex sleep apnea, a blend of both obstructive and central sleep apnea. So sleep apnea isn't just a bad night's sleep. It's a serious condition that can affect your breathing and overall health. But what causes sleep apnea? There are actually several factors that can contribute. Let's delve into the main culprits behind this sleep disorder. One dominant factor is obesity. Excess weight leads to fat deposits around the upper airway, obstructing the flow of air and leading to sleep apnea. It's a vicious cycle, really, as sleep apnea can also lead to weight gain, creating a relentless loop that's hard to break. Aging is another considerable factor. As we grow older, our muscle tone decreases, including the muscles that control our airways. When these muscles relax during sleep, they can narrow or block the airway, causing interruptions in breathing. Now let's talk about a habit that's harmful in more ways than one: smoking. Smoking can cause inflammation and fluid retention in the upper airway, both of which can lead to sleep apnea. The chemicals in tobacco smoke also harm the lungs and make it harder for the brain to control breathing. But it's not just about lifestyle or age. Genetics plays a role too. If your family has a history of sleep apnea, you might be more predisposed to develop the condition. Factors like having a naturally narrow airway or enlarged tonsils can be passed down in families and contribute to sleep apnea. Certain medical conditions can also increase the risk of sleep apnea. These include conditions like hypertension, chronic nasal congestion, and hormonal disorders. Even the way you sleep can contribute. Sleeping on your back, for example, allows gravity to pull the tongue and soft tissues at the back of the throat downwards, blocking the airway. Lastly, alcohol and sedatives can contribute to sleep apnea. These substances relax the muscles in your throat, making it easier for the airway to become blocked during sleep. Understanding the causes is the first step in prevention. But to truly diagnose sleep apnea, we need to look at the symptoms. The more we know about the causes, the better we can tailor our lifestyle and habits to reduce the risk. But remember, understanding is only the beginning. If you suspect you might have sleep apnea, it's crucial to consult a healthcare professional for an accurate diagnosis. The symptoms of sleep apnea can be a bit tricky to identify, as they often occur during sleep. However, understanding these symptoms is the first step towards managing this condition and enjoying a more restful night's sleep. Let's start with the most common symptom, which is loud and chronic snoring. This isn't your average everyday snoring. It's often loud enough to wake the person sleeping next to you. But it's not just the volume that's concerning. It's the pattern. People with sleep apnea snore loudly, then stop breathing for a moment, followed by a gasp or choking sound as they start to breathe again. Next, we have episodes of breathing cessation during sleep. This is when you actually stop breathing for short periods. These episodes can last for a few seconds to a minute or more. You may not even be aware of these episodes, but your partner or a family member might notice them. Another symptom that you might notice is abrupt awakenings accompanied by shortness of breath. This is a response to your body's struggle to breathe. You might wake up gasping for air, or you might wake up with a start, feeling as though your heart is racing. Excessive daytime sleepiness or hypersomnia is another symptom of sleep apnea. Because your sleep is interrupted throughout the night, you might find yourself feeling excessively tired during the day. This can lead to difficulties with concentration, memory, and even mood changes. Other symptoms can include morning headaches, insomnia, attention problems, irritability, and even waking up with a dry mouth or a sore throat. It's important to note that not everyone with sleep apnea will have all of these symptoms, and having these symptoms doesn't necessarily mean you have sleep apnea. However, if you're experiencing one or more of these symptoms regularly, it might be time to talk to a healthcare professional. They can help you determine whether you have sleep apnea and guide you towards the most effective treatment options. If you or a loved one is experiencing these symptoms, it's important to consult a healthcare professional. Sleep apnea doesn't just disrupt your sleep. It can have wide-ranging effects on your overall health. Let's begin with high blood pressure. When you're frequently awakened by the inability to breathe, your body becomes stressed. This triggers your hormonal systems to go into overdrive, leading to an increase in blood pressure levels. Over time, this can become chronic high blood pressure, a condition that puts a significant strain on your heart and arteries. Speaking of the heart, sleep apnea can also lead to a host of heart-related problems. The sudden drops in blood oxygen levels that occur during sleep apnea episodes can increase blood pressure and put a strain on the cardiovascular system. This might heighten the risk of heart attack, stroke, and arrhythmias, which are problems with the rhythm of the heartbeat. There's also an increased risk of heart failure. Now let's switch gears and talk about type 2 diabetes. Sleep apnea is common among people with this condition. Why? Well, the lack of restful sleep can lead to insulin resistance, a condition in which the body doesn't use insulin properly. This, of course, can lead to higher blood sugar levels and ultimately type 2 diabetes. Lastly, we have liver problems. People with sleep apnea are more likely to have evidence of non-alcoholic fatty liver disease, a condition characterized by fatty deposits in the liver. It's also worth noting that those suffering from sleep apnea may show more signs of scarring on their liver. As we've discussed, the effects of sleep apnea go far beyond poor sleep quality. They creep into various aspects of your health, triggering a cascade of issues that can significantly impact your well-being. From high blood pressure to heart problems, from type 2 diabetes to liver issues, the effects are wide-ranging and serious. Clearly, sleep apnea is more than just a sleep disorder, it's a serious health concern. So we've learned a lot about sleep apnea today. It's an intriguing yet complex topic that affects a significant number of people globally. We started off by defining sleep apnea as a sleep disorder that causes breathing to stop and start repeatedly during sleep. It's a condition that often goes undiagnosed, primarily because many aren't aware of its existence or its symptoms. We then dove into the causes of sleep apnea, which range from excess weight and narrowed airways to being male and being middle-aged or older. It's clear that the causes are multifold and can vary from person to person. However, it's important to note that while these are common causes, they are not the only ones. Other factors, such as family history and use of alcohol or sedatives, can also play a role. Next, we discussed the symptoms of sleep apnea. These include loud snoring, episodes of breathing cessation during sleep witnessed by another person, abrupt awakenings accompanied by gasping or choking, and excessive daytime sleepiness. We stress the importance of not ignoring these symptoms, as they can lead to more severe health complications if left untreated. We also looked at the effects of sleep apnea on your health. Sleep apnea can lead to serious health complications, including high blood pressure, heart problems, type 2 diabetes, metabolic syndrome, and complications with medications and surgery. The ripple effect of sleep apnea on your overall health is profound, highlighting the importance of early detection and treatment. In conclusion, sleep apnea is not just a snoring problem. It's a serious sleep disorder that requires immediate attention and treatment. If you or someone you know is experiencing symptoms of sleep apnea, it's crucial to seek medical advice. Remember, knowledge is power, and the more we understand about sleep apnea, the better equipped we are to tackle it. Thanks for joining us today on Brainetainment. Don't forget to subscribe for more enlightening videos on health and science. Until next time, stay curious and stay healthy.